Hi, it's your dentist. And if you're watching this, it's because I'd like to explain how I can detect problems with your airway and breathing and sleep, just by doing my usual dental exam. Doctors often overlook these signs. It's not their fault. They don't often look into the mouth. That's my thing. Dentistry has had an intellectual revolution. To be concise, your ability to breathe, as well as the size of your airway, is influenced in large part by your upper jaw, tongue, and even your teeth. Let me rephrase. The root cause of breathing problems, from full-blown obstructive sleep apnea to even slight resistances in breathing, may be influenced by or even caused by problems that your dentist can help you detect and fix. You know, we always thought that the only kind of people who have breathing problems are overweight older men, but that's not the case at all. You can be young and fit. You can be postmenopausal, or you can even be a young child. But you must know the why. The why is everything. The size and volume of your airway is influenced by the development of your palate. Compare this person with a high, narrow, arched palate with this person who has a wider, normal, arched palate. Note that the person with a wider palate has a wider airway opening. If your airway is the normal size, you can breathe. Anything less than optimal means you can't breathe as well. And what dictates the width of the palate, you ask? The tongue. The tongue is a strong muscle that is habitually postured to the roof of your mouth during childhood. And if your tongue can't rest against the roof of your mouth, and not just the tip of your tongue, the palate doesn't get stimulated to grow, and therefore your airway doesn't grow either. Are you still following me? Because it's about to get even more interesting. The roof of your mouth is part of a bone in your body called the maxilla, or the upper jaw, and the upper jaw is part of the nasal cavity. Tongue posture is the key to encouraging nose breathing. Breathing through your nose is needed to carry the full amount of air you need to be healthy. Furthermore, teeth crowding and poor maxilla development leads to impaired nose breathing. And if teeth are crowded, we often put the braces on and get the teeth straight, or if you have an underbite or an overbite, we use headgear to actually hold the jaws back from growing so the bite doesn't get worse. However, the problem is the teeth get straight and everything might look good, but the airway problem is still there, only now it's masked by the appearance of straight teeth. What if, instead of just straightening teeth, we also use orthodontics and dentistry to help the airway grow? We can do that. These problems are often seen, or I should say missed, in childhood, when we plan for children to get braces in their early teens. Dentists can be the best doctors to detect problems in even young children as well. Does your child grind their teeth at night? Do they suck their fingers or their thumb? Do they wet the bed even after they've gone off diapers? These are all signs that your child may potentially have a breathing problem. These children might have very enlarged tonsils or adenoids. They might have orthodontic problems or a congenitally deviated septum. If this is the case, you need to fix it to avoid problems for your child later in life. Young, fit females are some of the most unlikely people to have problems breathing, or so I thought. However, patients in this category are usually very high-functioning adults with disciplined schedules. They don't sleep too deeply. These patients don't really fit the bill for sleep apnea. Rather, they suffer from airway resistance syndrome. For some reason, they don't get the full deep breathing they need to repair their bodies at night. And because of that, their bodies release a steady stream of stress hormones called cortisol and norepinephrine. The young fit female with impaired breathing tends to have chronic headaches, TMJ pain, and muscle aches. They feel better when they work out because their bodies burn up the cortisol and norepinephrine with vigorous activity. These apparently dynamic and active patients might also need help with diagnosing and treating impaired breathing. You see, the intellectual revolution that I have had is that you don't have to have a closed-off airway to be considered a person who doesn't breathe. Just because you're not choking and gasping and snoring like an elephant at night does not mean you might not have a breathing problem. Anyone who doesn't breathe fully, deeply, and properly has a breathing problem. I started on this journey to learn all I can about breathing and how I can help my patients because my own husband has a breathing problem. He didn't fit the bill for sleep apnea at all. He even tested negative on a sleep study for it. Yet I still watched him night after night struggle to breathe properly. I thought, how could he not have a problem? So I began to do lots of extra learning, and I thank Dr. Jeffrey Rouse, a dentist turned pioneer in airway prosthodontics, in teaching me how it's not about the big, obstructive, choking, gasping events. It's about the small ones, the upper airway resistances, and the damage that this does to a body over time, from children to adults. A colleague of mine once said that breathing is one of those primal functions, and your body will do just about anything to keep breathing. The ability for oxygen to get into your body and repair the stress and damages we put on it helps us to keep diseases away. So it's not just about slapping on a CPAP or wearing a night guard. It's so much more than that. It's about keeping you healthy and solving the root cause. I would dare to be so bold as to even say that failure to receive full oxygen saturation night after night could be a reason why medicine has a hard time conquering many chronic inflammatory diseases, from diabetes to Alzheimer's. I know the best videos on YouTube are the really short ones, and I've tried my very best to be short and concise and cram in the result of several decades of research into this video. It's just a very small introduction, but one that I hope makes it a little clear to you just how important this is to me. I'd love to tell you more about it at your next dental checkup. Thank you for watching.